There are some hormonal shifts during pregnancy. I mean, typically what happens is pregnancy is a fairly hormonally stable time. You're not, unlike when you're not pregnant, you're not cycling. So you have a relatively stable estrogen and progesterone state. It's a higher progesterone state, so there is some fluid retention, which can give you breast tenderness and some fluid retention, which can be uncomfortable for women, but generally after the first trimester, people feel better. So hormonally, they're not as fluctuating as you might be during a normal cycle, because in a normal cycle prior to ovulation, your estrogen is rising and increasing. Then after ovulation, you're producing progesterone and you're getting cravings, premenstrually. So pregnancy actually fairly stabilizing in terms of hormonal shifts, and tends not to be a time when people have a lot of mood irritability. However, postpartum, that can change. There's dramatic changes in hormone production immediately postpartum. 80% of women do experience postpartum mood swings, what they call the baby blues. So we do prepare women for that. Postpartum depression is not rare, but it's not super common, but it's not rare. So we do prepare people also that if they feel more than what they feel are just normal baby blues, to call us. There does tend to be a tendency for women not to contact us because they're concerned that postpartum depression is a reflection on parenting ability, which it's absolutely not. Fabulous parents or fabulous moms can have postpartum depression and not call us because they're embarrassed by it, and actually it's a very treatable condition, and terrific moms can have depression that makes them unable to take care of their baby, greet the day, get out of bed in the morning, and it's something that again is very treatable, so we encourage them to keep an eye on that, and we talk to the dads about it as well. But generally pregnancy itself is a stabilizing time, and it's the postpartum period that can be a little more tumultuous in terms of mood irritability, mood changes, and it's also a very big adjustment period for women. I don't think anyone ever anticipates what it's like to have a newborn at home, the sleep deprivation, the emotional swings, and just adjusting to a new little life at home.